Good evening, ladies and gentlemen. Friends of Cancer Patients is honored to present a virtual lecture about family role in supporting women with the breast cancer, which will be given by Dr. Jacqueline Maria Diaz. She is a chair and associate professor, College of Health Sciences, University of Sharjah. Ladies and gentlemen, you are kindly requested to keep your mics and cameras off. And if you have any questions or inquiries, please drag it in the chat box, and the questions will be answered by Dr. Jacqueline at the end of the session. Now I will pass the mic to Dr. Jacqueline to start her session. Please, Doctor.
Okay, thank you, Ms. Hannah, for that kind introduction. Good evening and salam alaikum to all of you. I'm so happy to see so many people that have joined. And I'd like to begin by thanking the administration of Pink Caravan and all of you who've taken the time out for this session. And the fact that there are so many of you, it clearly means that you have a role in it, and it's something important. So it's great that it's there. I'd also like to acknowledge right at the upfront that for Pink Caravan for providing a lot of the data that I've used in the slides, and you will see that in the slides that follow. So I would really sincerely like to thank you all. The way I look at it is I'll present some facts about breast cancer, and worldwide, and then I will go about talking at the within the Emirates what is happening. And then I've been asked by the organizers to talk about self-breast examination because that's an integral part of preventing cancer. So that's very, very important. And then how to do a self-breast examination. We will not participate, but there will be some pictures that are there, and you will be able to do it. And if you're not doing it, I will encourage you very strongly, you and your family members, to do that because that's so important. From there, then I'll move into what are some of the treatment modalities that are there for breast cancer. And following that, we will talk about, the role of the family, which is the purpose of today's thing, because very often when you have cancer and you're alone, it's a very, very dark world. And we need the family to support the patient as they're going through. And I have a background in oncology and palliative care. And I've seen that a lot of work is done by the family in taking, yes, health professionals certainly play their role, but it is the family that actually are there and support the person with breast cancer or any cancer for that matter. So I thought that was and then we will conclude with where, as Ms. Hannah told you, there'll be some question and answer session. And, you may be able to, ask some questions. I may not have all the answers, but then there are people where we can refer you to and, create more awareness of the whole role of breast cancer. Now, you may ask, that the month of October every year has been dedicated worldwide to as the Breast Awareness Month. And why? And you see a lot of people wearing pink in this month, including me. I am in pink today. And just a pink ribbon, everything, which shows that they are supporters of, of breast cancer, and it's there. So actually, we all know that if we support it, if we are aware of it and we're able to detect it, we can actually prevent breast cancer from taking place. But to begin with, to share some worldwide statistics, is that there are, about 1.38 million new cases every year that come about. I'm talking about worldwide. And we know there's up to 500,000 deaths that take place because of breast cancer. So think of those cases that if they are diagnosed early, just a simple thing like a self-breast examination, you can actually prevent yourself from developing breast cancer, or even if you get it and it's a small lump, it can be nipped in the bud. So therefore, it is so important that, we take care of this breast cancer. And it's good that there is so much of awareness of breast cancer. Now, we know very well that if you look at the literature, there's a lot of growing knowledge in the area of breast cancer. And the knowledge is still, gaining momentum. There's a lot of evidence-based practice things that are happening. So the knowledge is increasing. So we can do what we can as health professionals. And I know many of you are out there in the lay community that can promote just by doing, self-breast examination and taking that, because we know that if, breast cancer is diagnosed at an early age and there's appropriate diagnosis and treatment, it can be prevented from going into further stages. So without further ado, These are some statistics that are there, and this is like Pink Caravan, and this is from there, which is actually from 2011. It's been a national movement here in the UAE, and you can actually see that there's so many cases that come, so many people that do a breast have referrals, both the nationals, residents, and you can actually see how. So it's a lot of a slide, but if you look at it, it's been growing, and if you look at right, the first slide, where you have about 10,000, and today in 2020, and we haven't finished the year, we have about 11,077 cases. So people have been examined, and so that way people have come and sought the healthcare system, and they've said. So the Pink Caravan every February and throughout the year arrange a lot of activities where they actually promote, breast cancer awareness and things like that. And you can see the women on the horses, the men on the horses, and we as here, even at the University of Sharjah, we participate in these activities very heavily with our students. So not only just creating awareness, but doing things. Of course, I know that the COVID situation is there, but going to the malls, giving people awareness, sharing brochures, and there are a number of videos and things that which has been created by Pink Caravan to promote, the awareness of breast cancer. So I would recommend that you see that and share it with your friends, share it with your family members. It's important. Now, just for those who are health professionals, it would be a revision. For those who are in the lay community out there, I just want you to take a look and, it's how is the breast designed? So remember, the breast that is there, it sits on the chest muscles and it covers the ribs. And we have each breast that's actually made up of about 15 to 20 lobules. And these lobules will contain smaller lobules. Now, what's the purpose of the lobules? The purpose of the lobules is that it contains groups of tiny glands that produce milk. And we know, those of us who have breastfed our babies, the milk will flow through the lobules, through the thin tubes called ducts to the nipple. And we know that at the breast, there is the center of the area, which is a darker area, and that's called the areola. And we know that the space around it is fat, and that's there. So of the breast, it's there, and we have this. We are, blessed with that, and it's there. Now, the information, and it just goes that we know that every, there are about 100 newly diagnosed breast cancer cases, and probably out of them, if you look at it, but 99 cases will affect women. But that's not to say that men are not affected. So it's important that we don't only just target the females, but we also target the males. So both, and breast cancer is common in the men as well. Now, although the diagnosis rate for men is low, it is still an important concern, as breast cancer in men tends to be very, very aggressive. And the survival rate is probably lower, and it's also sometimes, even not so easy to diagnose. So it's just a matter of being aware of it. And that's what we are creating through these health education sessions to the general public. Now, out of the 10 lumps, and very often women do find, a lump when they do it, 8 out of 10 cases are usually benign, okay? But it's still there. And we all know that according to the statistics that are revealed and the literature has, shown us, that about 98% of the breast cancer cases are curable if they are detected early. So that's something statistically that needs to be. Now, this morning, there was a session through the Pink Caravan as well. And one of my colleagues here from the University of Sharjah talked about, the risk factors and what you can do in terms of your food. So we all are at risk, and even there, and we know that there's some things that we can. We know that obesity is one of the factors. It's controllable, but you can reduce your weight. That is something that you and I have in our control. Not having children is another. We know that people who are, have children have that, more of a chance of, this thing getting it. So breastfeeding can be there. So we encourage, and these days, there are a lot of breastfeeding hospitals that are all over there, baby-friendly hospitals that have arisen. So the idea is that, it's promoted breastfeeding, and it's more and more encouraged these days. It may not be so prevalent in the UAE, but alcohol is also known to be a risk factor. And of course, a lot of women go on hormonal replacement therapy, and that can also be, something that we could, control. Do we really need it? These are questions you need to ask yourself. And of course, exercise. get into an exercise regime. These are things that there. So basically, what am I saying? Or what am I kind of implying? You and I have control over our lifestyle choices. And what I mean is that, we can eat a food that's high in fruits and vegetables, whole grain, and low in saturated fat. So this is something that is within our control. You and I can do that from time to time. You and I can maintain a healthy weight. We know our height, we know our weight, we know how much we should be. So why can't we do that? Exercise regularly. Simple things. Do you need to take the elevator? Can you use the stairs to walk up? Okay. Can you do that? Even if you have a desk job, can you take every 10 or 15 minutes and just walk around? Things that you would ask somebody to bring for you, can you go and do it yourself? Can you get your groceries? All of these things are within our control, and these are lifestyle choices that we can make to improve our lifestyle. Control your blood pressure. Probably that is something all of us can do. We know by diet, we know by walking regularly, we know by certain foods that will up, we all know chips and snacks and all these things. Is that really necessary? Keep an apple, keep a banana, keep a fruit instead of indulging in all. It's okay. I mean, I know once in a way we all do that, but these are things that we can do. Avoid smoking and alcohol. That's something that can be done. And probably develop a lifestyle where you can actually ensure that you get an adequate night's sleep. I know with this, the phone, I know my kids, they're chatting. I mean, it's at, 12 o'clock life starts for them. Why can't we get it? We all know that, they say the early bird catches the worm. We were brought in with these little, sayings, but why don't we follow them today? Why don't we get our kids to follow them? Get a good night's sleep. I know it's very easy, put your mobiles off in the night and get up. We just wait for the mobile to go click, and then we say, how many likes did we get on Facebook? How many likes did we get on Insta? These are all causing stress for you and me. If we can control that, that would be the best thing for you and me. And of course, get better at managing your own stress. Ask yourself, what is making me stressed? What can I do to prevent it? Sometimes it's, simple things, you don't have to do, you say, okay, I can't find a parking spot and therefore I'm late for class. I'm sure many of you, my students tell me, oh, we are late for class and let's test out. Of course, now in the COVID, it doesn't happen. I said, set out 15 minutes earlier. Okay. And if Jamila is there, I know I've given Jamila this advice from time to time. Set out 15 minutes earlier because at some roundabouts, there's a lot of traffic. So these are things that you and I can do. Meditation has been known to be very helpful and to help people, again, to make a lifestyle choice. Yoga, exercise, all these things, all of us can do to promote our own lifestyle. Now, the next thing that you ask yourself is, who is at risk? Okay. And yes, we have said, everyone, but we know that after 50 years, you are more prone to it. So be more cautious. Okay. We know if you've had a rich family history, somebody has had breast cancer in your family, a mother, a sister, an aunt, you're probably more likely to, be a victim. So be aware of that. Those who've not given birth, that's another area. Those who've had their first child after 35 years, they are also very, very prone to it, and it's known there. And those of us who started our menarche after the age of 12, that is another reason. Then you have late onset of menopause. So if that happens, that's there. Sometimes check your breast. Is it sometimes the secretion from the breast that can also cause it? And that could be a chance. Of course, if there's a history of cancer in the family, you're more prone to it. So be aware of that. And foods and fat should be avoided at all costs. Don't drink it because, alcohol, we know does it. I've talked about avoid smoking and contraception. So these are things that one can do to prevent one from getting it. So coming now to what is the crux of today's presentation is, how do you protect yourself from breast cancer? And one of the things that is very, very easy and can be done and make it as part of your lifestyle is doing regular self-breast examinations every month. And the next slide, I'll give you some tips on when would be the best time. Do it regular breast clinical examination. People who are over 40 years have it done by a doctor, either through a regular annual checkup. And of course, mammography is recommended after 40 years, every 2 years, just to rule out if there's any lump or something that you will feel. And of course, if you have a rich family history, a positive, do the mammography even earlier. There's no harm. But you can reduce the risk of breast cancer by these pictures that are depicted. Exercise, get up 15 minutes earlier, put your alarm for half an hour before and, indulge in some exercise. Walk around the block, things like that. Park your car, maybe 5-6 kilometers away and walk if you can. That's a healthy morning walk. Quit smoking. Keep your weight within healthy limits. Eat healthy and breastfeed your baby, those of you who are in that age group. So these are things that you can do which will prevent. Now, the point is that we have signs and symptoms that will come. And when you do a self-breast exam, if you feel a suspicious lump, it could be as small as a mustard seed and you can feel it, when you do it. If you see any change in the breast shape or the size, if the nipple goes back, the retraction of the nipple, or you feel there's a change in the color or the texture of the skin around the areola, the breast, or if you find there's a discharge, coming out of the nipple, you're not breastfeeding, there should not be a discharge. Or you feel there's a continuous heavy pain in the breast, consult a doctor. Don't wait, get it done. And these are things, the pictures that depict the same thing. So it's very, very important that we take care of our own and be aware of these signs and symptoms. So I'm going to repeat that again. Any suspicious lump that you might feel on examination, if you find there's a change in the breast shape and size, if you find the nipple is going back, it's retracted. You and me all have our nipples pointed in front. If it goes back, it's something to a cause for concern. Any change in the color or the texture of the skin should be notified. Any discharge, you're not breastfeeding, you should not have a discharge from the nipple. If there is, that is a cause for concern. And if there's continuous pain, these are things that you should seek the healthcare system. So these are small things that you and I can do. And I would emphasize and re-emphasize the importance of these signs and symptoms. So be aware of it. What are we doing through these sessions in the month of October and throughout the year is making you aware of your own body. Now, these are some pictures. And like I said, what's very important is that before you even get started, decide which one is easy. There are three. There's a circular motion, there's up and down, and there's a wedge motion. So you can decide which one works for you. It's not one is better than the other. You just do one that you think is, but then keep to that one for every month. Now, when is the best time, you may ask me? If you're pre-menopause, the best is to do 7 days after your menstrual cycle ends, your period ends. And why 7 days? Because 7 days is the time when everything kind of goes back. You all know that before you actually menstruate, you feel very heavy, you feel very bloated. There's a lot of fluid that is, in the body. So that is something that might be happening. So it's best after your menstrual cycle ends, wait for at least 7 days and then do it. If you are post-menopausal, you're not menstruating anymore, you have finished, then choose the 1st of the month, the 15th of the month, your birthday, if it falls on the 6th of October, then you do it every 6th October, 6th November, 6th December. So keep a regular routine. That is the important. Now I'm going to just demonstrate. The first is the circular motion. So when you use the tips of this part of your hand, you're actually going in a circular motion. So this is your breast there. You are going from the inner and you're going outer. And as you do it round and round, you will feel if there is any lump. Even if it's as small as a mustard seed, you would feel that sometimes that is there. The second one is the up and down. And the up and down is like you're going like a hill. So you're going up, down, up, down, up, down, up, down. And the third one, which is called the wedge motion, is like a cake. Have a cake and cut it into 8 pieces. So you're doing each part. So this is the circle, the center of the cake. You are going here, whether you're doing it clockwise or anti-clockwise, but you're doing it slowly and gradually. So it's like, think of a cake that you've cut into 8 pieces and you're going on and on. So again, I'm going to repeat that. The best thing is to do, there's no one that is best, But make sure whichever one you use, you will. So you can ask me why. And the thing is that if something was not in the month of October and suddenly pops up in the month of November, you will be able to feel it. Circular motion, just like a circle, you're going round and round. Okay. So you're doing this slowly, gently. Don't be rushed. Take your time. Okay. Then if you're up and down, you go like you're going up the hill, down the hill, up the hill, down the hill, up the hill, down the hill. And if you're doing it in a wedge, is like a cake. Like I said, cut it into 4 pieces, 8 pieces, and then go in a clockwise direction. So you're slowly doing it, and you're checking it out whether this has to be done slowly. It shouldn't be rushed. You shouldn't be attending the mobile while you're doing it. You shouldn't be, seeing television. Do it at a time when you are free, you're relaxed, and you're able to assess it, because you want to do it. It's for your own health that you are doing. Okay. Now I'm going to move on. Very often, a lot of women find this is another good way, is to lie down. And they place a pillow under the right shoulder. So you're kind of placing it. And again, you place your right hand behind your head. So you're supporting it. So if you're this way, and then, or this which you're doing it, and then you place the inner parts of the 3 middle fingers, and you go round and round. So you can again feel that. And again, you will feel for any changes in your breast, above, below the collarbone, and even your armpit. You may even find sometimes in the armpit, you have like a lump that is there, a hard node or a thickening of the skin. So do one and then go to the other side. So again, you can do this lying down and doing that. That is also very, very much acceptable and can be done. So choose for yourself. And I think sessions like this actually tell you that you begin to find for yourself when is the best day that I would do. So if you make a promise for yourself, that if I'm doing it, excellent. Okay. But if I'm not doing it, then I will choose a day every month and I'm going to do it, because I'm doing it for my own health, for the health of my family. That is why we are encouraging you to do these self-breast examinations. And again, another thing that is another way is stand in front of a mirror, expose yourself. Place your right hand again behind your head and use your left inspect all the areas of the chest and the breastbone, just like when you did when you were lying down. So this is again, one you did when you were lying down on the bed, one you did when you were standing up. So again, do one breast, then go to the next breast. And the next one is stand in front of a mirror and put your hands on your hip, and bend forward. And you will see, is one breast bigger than the other? Is it bending forward? Is there again any puckering? Is there any retraction? Is there any dimple? Is there any discharge? Is there anything that looks to you that it's not normal? You know your own body, okay? So ask yourself, is there a change in my body? Am I feeling something that's different? And the best is to catch it at the early stage. So I would recommend that do this for your own health. That is the important part. Now I'm going to move on. And the next part is I'm going to ask you, and I'm sure you can just take a minute to think for yourself. When you know all of this, why don't women do self-breast examinations? I mean, there are a list of reasons, there could be more. Just take a minute and ask yourself, do I do it? And I'm going to give you a second or 20 seconds. Do I do it? And if I don't do it, why am I not doing it? So do I fall in these categories? Is it because of fear? I'm scared I might find something? Is it I'm embarrassed about doing it? Is it, I'm young, nothing's going to happen to me. I'm in my youth. Or I don't have the knowledge. Or I'm too busy. I told myself I'll do it on 6th October. Dang, 6th October is gone and it's 6th November and it's 6th of December. And before you know it, it'll be 6th of Jan 2021. So we have to be ready to remember to do these. And there are many myths and facts, that are there. And this is I've taken this from the net. But there are people say, breast cancer only affects the older woman. It's not going to affect me. I am young. Okay? If you have a risk for breast cancer, you are likely to get the disease. So I'm not having any risk factors. I'm underweight, I'm eating healthy, I'm blah, blah, blah. I don't get it. Using antiperspirants causes breast cancer. So this is another myth, that is there. And breast cancer diagnosis is automatic death sentence. So no, I'm not going to do it. So these are things that there are some myths and facts that are there. Very often these myths also there, and you hear it from a number of patients. Touching the breast too often will lead to cancer. Don't worry, it will not. Talking about cancer will cause cancer. People say, don't talk about cancer. It's not going to cause cancer, okay? We are creating an awareness. Using illegal drugs can cause cancer. It may cause anything. Sometimes, I took these herbs, therefore I got it. A bruise on the breast will lead to breast cancer. If an incision is made during breast cancer surgery, my cancer will spread. It will not, unless it is a malignant cancer. And I had too many mammograms, so therefore I'm going to get breast cancer. The radiologist put it, no way, it doesn't happen. Okay? And remember, mammograms are only used to evaluate breast lump. They are there. So these are myths that are there. They are floating in the market. You hear them in social circles. You hear them on the internet. And then people begin to pick up these things and say, these are there. So it's very important. And again, this is just a picture that to show that if you have a persistent lump or you have any thickening, sometimes it could be fat actually. So be careful, If there's any changes, again, in the color, in the breast, the nipple, dimpling, puckering, the scarring, scaling, be aware. Okay, so these are things that you can do. If the nipple is retracted, if you find there's a discharge, all of these things, you should consult the healthcare professionals and you should take advice on these things. So these are just symptoms that I'm repeating. And the reason I'm repeating is it should stick in the head. And I know many of you are from the lay community as well within the session. And so it's important that we, reinforce these messages. Now, moving along, people get breast cancer and it's there, it happens. Okay? There are different treatment modalities. It could be radiation, it could be chemotherapy, it could be hormonal. So again, it depends on what stage of breast cancer it is, what is the doctor's preference, you have the patient's preference, and you may be getting it. So here comes the role of the family and helping you to decide right from the time you get the diagnosis, breaking the news that you've got breast cancer. It is not an easy thing, believe me. A woman goes into depression, goes into what did I do? Why did I get it? You start bargaining. You start looking at, asking God, why did it happen to me? What did I do? You start questioning your lifestyle. All of these things happen when you get it. And therefore the family, give them time to talk. Give the family time to ventilate. Give them the space, And I think that's something as health professionals, sometimes we do not do. And this is again, we say, okay, you have chemotherapy today, Monday, Tuesday, and Wednesday, and then you get a break for 2 weeks. No, give them time. Let them make options. Let them decide what is best. I know as we have sometimes a limited choice to be able to tell them, but you can advise them what needs to be done and what will be done. So moving on is the role of the family. And the family play probably the most critical role in taking care. And sometimes it's just a matter of being there with the person, As health professionals, I find very often if the patient wants to cry, let them cry. Our knee-jerk reaction is when someone cries, what we do? We run to bring a bottle of water or the great tissue box. You see, it is our own coping mechanism as health professionals. So run and bring the water or run and bring a tissue box. Okay. And sometimes they just need time to cry and just know that the health professional is by there. If it's a family member, yes, the family member is there. Let them cry. It's not easy. They have to think of so many things. Your whole quality of life is affected by breast cancer. Your whole way of living. Suddenly you do not want to socialize anymore. Suddenly they don't want to meet anybody. Suddenly, their job may be affected. They may have to take time off from work for treatment. There are so many things. And this is a time where they just need someone to, talk and help them with there may be physical problems. We know very much the most thing, losing of hair. The loss of hair is probably for a female one of the most traumatic things in her life, to know that. And I've talked to patients who've had breast cancer and who've had treatment and who have been on chemotherapy. They've actually shared this with me, and they've said, it's just because it's affecting the good cells and the cancer cells. The hair just falls off one day. It's just like, think today you've got hair and tomorrow it just falls. You're taking a shower and it just falls off, and it's frightening, the whole thing. And they need that support. Sometimes maybe they want to wear a wig, and we need to advise them, where can you get a wig, or tie your hair in a bandana, or whatever they may want to do. So explore options with people. Ask them what would they like. And sometimes there could be, a lot of psychological problems as well, because depression and distress is very much. And again, I'm speaking from experience as an oncology nurse. They will tell you, things, and I'm sure if you've had family, they I may not see the birth of my grandchild. And for that, it's a very traumatic. I may not see the graduation, because I know I have a lifespan of X number of days, and I may not be there to see my child's graduation or my son's marriage. And these are painful events that the family have to deal with. And there's no answer. We do not know what the time is, appointed by a heavenly being, but we can help them. And very often what I can give you from my experience is, we've asked me, what would you like? You're not going to be there for your son's graduation. What would you like to do? And they said, there's nothing we can do. And we've, advised them. And these small things work. Can you write a letter to them? Put it in an envelope and seal it, and let it be there. So it's open on the day of the son's graduation. Okay. Your daughter is getting married. Write a letter that as if you were there, and some advice the mother wants to give her daughter at the time of the marriage. You can write that, and that can be opened at that time, sealed and put away. So these are some things that help, but you have to explore with them, what would they like to do. Sometimes they may want to see a spiritual advisor. They may want to see their religious leader, get, some religious benefits from them, drink some holy water. These are people who need that support. And we know sometimes Abe Zamzam is needed. They want that, give it to them. Sometimes they want just to have family pictures around them. And we as health professionals very often say, no, this is a hospital, you cannot have. All that they want is a picture of their family member. So we have to be sometimes accommodating to help these people. They're going through a tough. If you can do something to bring in their own, no, this is the hospital blanket. Can they bring a quilt? Would it really make a difference? They're about to go. So these are small things that you and I can do as health professionals to help them. And of course, chemotherapy has its side effects, and it's really painful. So these are things that you can help them. Give them the advice, as if you're on methotrexate, whatever drug you may be on, these are the side effects that will be needed. And sometimes it's small things, they may want to know where can they, what should they use, just shampoo. Maybe Johnson's baby shampoo is probably the best. It's mild, it's good, it doesn't break the roots as they form. These are there. Where can they go to, which hairdresser to, have themselves done? Sometimes these are small things, but this makes the role of the family. But it's important that families communicate, and they're able. And of course, I understand there'll be financial burdens, there'll be all of that. But at the same time, you and I as health professionals can help to make the life more meaningful and to bring about some quality of life for the patient who's having cancer. Another area which has proven to be very, very beneficial is support groups. And support groups is those who are cancer survivors. Those who've had cancer can actually probably share their experience at there. So sometimes, and I know that even Pink Caravan does this, is you can actually have people talk to other people who've gone this. As health professionals, yes, I can tell you what can happen. I can tell you what are the signs, but I haven't had breast cancer. Do you think I really know what to say? Have I gone through that experience? No. But if you bring another person who's actually had breast cancer, they can help the women to get through this phase of their life. So it's very, very important. And we know that people have benefited. The literature is replete with evidence that there are people who have helped because the support groups, and today you don't even have to physically come. Thanks to WhatsApp and to all these technology, people can talk. And then at the end, sometimes, uh, a lot of people have gone into creative modalities and poems, drawing, just songs, listening to Rumi, listening to different, religious music, whatever gives them that solace and that peace. And sometimes it is from the support group that they get these kind of help. So very often, the best thing I feel as health professionals is join them together with somebody who's come out of it and who's, so there are lots of, if you go on the net, there are lots of beautiful stories. People are telling you the experience that they've had. There, people are telling you of how they have managed, how they have coped. And, hearing it from people who've gone through it is there. I know of many places where, where you have people come for daycare for chemotherapy. You have hospitals that actually have patients who have had it, and they come and they just go around, and talk to people while they are there. And because they've gone through it, people can relate to them. And it's much more easier, and it's a much more healthier where you can actually get a one-to-one and share sometimes. Sometimes, the patient who has the breast cancer is not able to discuss sometimes things with their family, but they can discuss it with somebody else who has gone through it. So these are things that I would strongly urge. If you know of somebody, it's there, contact people in the Pink Caravan. They have a lot of support, and they have support groups that are there. That actually is about my end, and just like to close with the things that I've picked off the internet. But it's a time of reflection, and the next one that I'm going to show you, the slide, is actually a reflection, because once you get something like breast cancer, or any cancer for that matter, you go back and you sit and reflect, and you kind of come to terms. Things which you took for granted no longer are taken for granted. You begin to see the value, the beauty, of even a flower, or the beauty of a relationship, the beauty of so many things. So it's here. This was something that I copied, and I'll just read it out. It's directly from the internet. I fought the battle and won, and now I'm back and better than ever. For cancer has been a mirror held up in front of me. It forced me to take a good look at myself and bluntly asked, "Where are you going?" And it made me redefine my priorities, teaching me that it is really the little things in life that matter. Stop to smell the flowers. Stop to look at the sun. Stop to look at the clouds. Admire nature. This is the time where people actually begin to reflect on life. It gave me the vision to see angels walking among us, calling themselves friends and family, touching my life deeper than I ever dreamed possible. Cancer asked me to embrace a change in myself, the change that forced me to grow and become the person I always wanted to be, but never seemed to have the time to achieve. And change always took a risk. Stepping from the unknown into the unknown, I had to embrace uncertainty and accept that I was not in control. So, probably when you come to terms with it, that you're not in control and embracing the uncertainty, that's when you're actually able to come to the acceptance of the disease. It's been the ultimate test of my character, forcing me to trust my heart and to reach deep inside. For strength and power I never knew I had, I came to realize that even though I had cancer, I was never a victim. I'm a survivor in heart, spirit, and always will be, even if that test takes me my last breath. Cancer truly is a defining moment, a moment that made me redefine the impossible. And since I did, nothing will ever be the same again. It will be better. So this is taken from somebody who's definitely a survivor of cancer and is able to share and express. So sometimes, like I said, just giving them a pen and paper, or colors for them to express, these are very, very, or even sometimes sewing, knitting. These are things. On the weekend, I saw on Netflix a movie, Stepmoms, and it's actually a woman going through, having cancer, and actually it shows with how she is, able to cope and prepare herself and prepare the children for the inevitable, where death does come upon. But she gives them some things that they can live by, and she makes a quilt, and she puts in baby pictures over the years of the children, so they'll have something to. So that's creativity. Her little son is likes to think he's Houdini, the magician. So she makes a cloak for him, the Houdini, magic cloak, and puts it. There are many ways that one can do, but you have to explore with your patients, with your clients, and see what they have. And the last slide is actually just a concluding, but I thought it kind of says that and we all wear this breast cancer, which indicates hope. So that's something that I'd like to end with. There's a cloud overhead. You've got bad news. You can give up or hope. You can choose. So it's up to you. You can choose to have hope. You can choose to have faith. You can choose to have guidance if you choose to pray. I know it's a struggle moment by moment to get through each day when you're feeling so broken. But if you look to the Lord, the God of all answers, then you'll find hope, and there's hope in your prayers. Because you and I both know that prayers are accessible, always at hand, and God hears them all. It's part of his bigger plan. So choose to be brave. Take hold of your heart. You choose to have hope when you choose to have prayer. So I'd like to leave that. And the last slide is a concluding slide where I would say, we all look at breast cancer in the world, but there is hope. So thank you for the opportunity to ping Caravan and the administrators. And I wish you the best of health. I would like to give you the take-home message that it's important, number one, to do your self-breast examination. If you're old, you need to take care of your diet. You need to take care of exercises. You need to have a stress-free diet. This is within your control. This is my take-home message for all those who've taken the time out for today's session. Thank you very much. And I believe the organizers will now open questions. Thank you.
Thank you, Dr. Jacqueline, for the informative session. And now we will be having a few questions from our dear audience. We have first question from Hanadi Abdel Nasser. She's asking about, does breast cancer happen only to married women?
No, it happens to all people, any age group, even to the males.
Thank you, Doctor. We have another question from Nick, I think Solar. Why there is so stigmatization attached to the breast cancer?
Okay. In my opinion, and again, Ms. Nick, I think the way it looks at it, there's a lot of people do not want to be, this is something that has just come about in the last decade or so, where this awareness has come that you can have it. A self-breast examination, do we teach our children in schools? You see, so people grow up that, the breasts are shameful. We should not be, we should not be doing it. And so people have this, and then there are so much of these myths going that, if you touch your breast regularly, you will get breast cancer. So there's a lot of stigmatization. Then there is a feeling that, oh, because I have breast cancer, I have it, so, I will give it. And, so this is something, and it's only through awareness sessions that like this, like Pink Caravan does regularly. These are where people can actually, express them and be aware that this happens. But it's just part of the thing. It's sad because until you have more and more awareness, out there in the larger community, people are always going to think, it happened because I did something bad. It happened because I told lies, or it happened because of this. So I think we can create that as health professionals, and decrease that stigmatization. Thank you.
Thank you, Dr. Jacqueline. Does anyone have any questions? Thank you once again, Dr. Jacqueline Maria Diaz, Chair and Associate Professor, College of Health Sciences from University of Sharjah. Ladies and gentlemen, we hope that you enjoyed our awareness session, and we hope to have you again and again in our coming session. And to know the timing and the dates of these sessions, please follow up on Friends of Cancer Patients and Pink Caravan on all social media. Have a lovely evening ahead, and thank you for everyone.
Okay, thank you again. Thank you.